I believe we are live, and for those that are just joining us or getting to join us because it just started, this is obviously the One Door Task Force. This is our second meeting. You just missed a riveting presentation by the Mississippi Department of Employment Security. We will gladly provide any information, and thank you for the answers to those questions. Briefly, I would like to, since we're good, up and running. I would like to take the opportunity, and if you have a mic, or I'll be glad to pass this around. Obviously, Representative Donnie Bell and myself are co-chairing this task force. It's addressing how our state agencies service Mississippians in the sense of looking to help them with a benefit, particularly. Maybe sometimes they come in seeking a specific benefit, but what can we do to make sure that we open the door completely to them to see what opportunities are out there that help them grow and to move into a better lot in life to a great degree. But I would like, and I don't mind passing this around, or you got to push it and it has to turn green. I would like for each member of the committee to introduce themselves, since we're now actually up and recording, so people will know that. I'm Daniel Sparks. I represent Senate District 5 and Tishomingo, Etowah, and Prentiss counties.
I'm Donnie Bell, and I represent Etowah and Monroe County and chair of the Workforce Committee.
Hey, I'm Cale Smith, Executive Director of the Mississippi Community College Board. To my left is Dr.
Hey, good morning. My name is Billy Taylor. I'm the Executive Director at the Department of Rehabilitation Services. I have with me Samandra Murphy. She's our Chief of Staff, and our Finance Director, Andy Salem. Thanks.
I'm Bill Ashley, the Executive Director of the Mississippi Department of Employment Security. I also have brought many people to me to introduce. My deputies are Timothy Rush, Laura Ring, Guy Martin, and Jason Pope.
I'm Augustus Collins. I'm the Chief Executive Officer for MINAC Incorporated, job training and development company right here in Jackson.
Courtney Taylor, Executive Director of the Office of Workforce Development.
Hey, y'all. My name is Rebecca Staples. I am president of Free State Strategies. I'm also a fellow on work with Empower Mississippi. And so in that role, Speaker White appointed me to the One Door Task Force. I'd like to say thank you to the co-chairman for looking at this. One thing that Empower has been looking at is labor force participation. And so we're really excited to be a part and loved hearing the presentation, Bill. So thanks.
Yes, good morning again. I am Billy Graham. Put a smile on your face. You look better when you smile anyway. But I am Otis Anthony, and I serve in the House and appointed to this committee by Speaker White. But I live in Indianola, in the heart of the Delta there, and represent Sunflower and Bolivar counties. And I do have a couple of questions, Mr. Chairman, when we finish the introductions.
And I believe that's every committee member we have. I think John McKay is not with us today, was a appointee of Lieutenant Governor, and I believe Mr. Collins, you're as well an appointee of Lieutenant Governor. And so if you have a question, please go ahead, and then we'll move into the next presentation.
Yes, and this is to the MDES. One, if you have an extra packet, I would like to have one. I apologize for being late. But two, in Indianola, thank you. In Indianola, we were one of the sites that was closed. And just a question, was that a efficiency decision that was made? And do you see a reduction of services that would be in that area of the state that you provide for that constituency?
As far as when job center locations, those are determined by the local workforce development area. Yes, since I guess last year, 2024, we've been looking for efficiencies. The State Workforce Investment Board has asked us to essentially put more money or make sure more money is in training. And as far as efficiencies go, that was one of the reasons. As far as absorbing that, we're also working with the locals. We have two other wind job centers as well on Highway 82 in Greenwood and Greenville. And then we would look to, continue to make sure that we have RESCA appointments and make sure we fill the full service to the best that we can. I know Jason Pope can speak more strategically or tactically, I should say, as what we'll do there. Dr. Pope.
Yeah, we're actively having conversations with the PDD up there about different ways that we can continue serving in Indianola. We're looking at the digital access tools as well as the mobile unit. So we may need to work with you to try to help us find a part-time spot to put some of these tools in place.
Thank you.
Looking at the agenda, I believe the Mississippi Action Learning Network would be next to present. Who is going to present for them? Okay, please come forward, and we would love for you to have one of these wireless microphones in front of you so the people watching this can hear.
Now we're hot. Okay. So we're asked to participate today on behalf of the Mississippi Action Learning Network, which is a group of state agencies and other organizations that were brought together to have some discussion about opportunities for collaboration, innovative programming, and then also just ways to improve the client experience with government agencies. So examples of agencies that were part of this include our agency, Department of Human Services, Department of Health, CPS, many different other agencies, Medicaid, but then also some other organizations outside of state agencies. So we don't come representing necessarily our individual agencies today. We come representing this group and some of the thinking that came out of this group. That's especially because one of the things that this Mississippi Action Learning Network did last fall was to convene a work group to explore the development of an all-in-one resource and referral center. And so now that this One Door Task Force is in existence, we're like, oh, we need to connect some of the thinking we've done and kind of share that with this group. So the reason that this group wanted to explore that idea is that Mississippi Department of Human Services operates existing child care resource and referral centers across the state. We have 50 different resource and referral centers, but those centers are focused specifically on child care access for families as well as for providers. So connecting providers with resources and then also families with resources related to childcare. So the thinking was, what would it take to build on these specific places across the state that were already operating to expand access to additional services for families? So I wanted to share just 5 takeaways from the work of this group. So this group met for several months, had a lot of in-depth discussion, and we're always glad to share more about some of the things that went into that. But what would it take to kind of build on that individual location, expand out the services for that location to take it to a true kind of one-door type of resource and referral center? One of the key things that the group wanted to share is that there's really a need for a focus on community buy-in. We all know that there are times whenever we, the experts, put in things in a community and the community doesn't necessarily think that's the best fit for what they truly need. And so this is something that the group said, really think about that. What does it look like to build community buy-in? What does it look like to have on-the-ground discussion with people to understand their actual needs, their strengths in their community, and how those things could work together? The second one was to commit to quality services and shared metrics. So any organization or program that's part of a resource and referral center must be willing and able to commit enough resources to this. So that means that maybe you need to commit staff, maybe it means that you need to commit other types of resources to this. But it can't be an in-name only participation. It has to be a meaningful participation. So that was one piece of that, and then also to commit to shared metrics. So we have to all agree what we're trying to do together and be willing to truly lean into those metrics and use that information to make improvement. And then working toward comprehensive services. So a resource and referral center might start out with a few services that families could access, but we know that there's a lot of different social determinants of health that maybe are also social determinants of work, right? So how can we help people connect with those things that they truly need? So even if you start with a few services, what does it look like to have a data-informed approach to identifying what other services need to be part of this model? And then empowering clients. So doing things with clients, in support of clients, and not for clients, right? The goal is to empower people in their own journey, in their own story. So really thinking about what kind of client experience is needed. How do people feel when they're in this space? Are they served with dignity in this space? Those things were all pieces that were important to lift up. And then track impact. So kind of going back to what we said before, what does it look like to have shared metrics and then to have those drive actual change? Not enough to collect the information. Got to use the information, right? And so having a shared commitment to that. So those were 5 takeaways from some of this group's discussion and work that we just wanted to share with this group as you kind of move forward with your one-door discussions. Another thing that we got into a lot was, do we mean a physical one-door or do we mean a digital one-door? So we had a lot of discussion around that. What do people really need? We're seeing some changes around that. But what we kind of came away from that with is that across both physical options and digital options, it's that co-location is not enough. It's really about moving to one relationship. One door really means one relationship. We don't want people to just come into a space and then have to go to all these different people, right, without somebody there in partnership with them. So that was something else that we would really like to bring to your attention, is to think about what does it mean to move toward one relationship, that people can leverage that one relationship to access multiple things, to have other doors open to them. But where are we now? So we are both part of state agencies. We're really interested in helping Mississippians be at work and be at work that can help them be self-sufficient. But right now we know that we have so many doors and it requires so many relationships to navigate these complex systems. We have some fragmented workforce supports from different agencies that are trying to move in the same direction, but are maybe doing so from different angles. Social support programs across many different agencies. And then data systems that don't talk, right? Some of that is because of federal privacy pieces, right? But unintegrated data systems. But even in the face of these things, we think that moving to a one relationship mindset can happen even while we work on bigger systemic changes.
So an immediate opportunity for impact that emphasizes the concept of one door and one relationship is the coaching model. The coaching model provides participants a single relationship, a single person that focuses on 4 core areas: eligibility and enrollment for a lot of the services that we've talked about that might be currently fragmented, goal setting for things like housing, your personal education goals, maybe it's recovering from an addiction to wellness, coordinated service planning across agencies, and then removing barriers on transportation, getting your ID, things like that. And so what exactly can we do right now? As Claire mentioned, we have individual agencies that are doing great work serving our vulnerable Mississippians, but whether it's TANF childcare at MDHS, job support at MDES, clinical care at the Department of Health, or administrating benefits at Medicaid, all of these agencies are using separate IT systems, intake forms, and staffing rules. I can tell you at at the Department of Health, where we're in the middle of a massive data modernization effort within our agency alone, our starting point was over 500 different databases housing different data, and sometimes, as you know, dictated by federal components. But even with this current state, the coaching model can allow us to unify the frontline experience without needing to unify, all of the back-end data just yet. And so the way that can work is the coach can be trained in eligibility criteria and processes for the major programs. They can know how to navigate the intake systems, and they can directly schedule appointments with other agencies, and they use kind of a standardized form or outcomes tracker. And this allows both the coach and the participant to see the full picture of their progress towards independence. And so the immediate approach with this coaching model is to really focus on building the communication protocols first and not necessarily the data. And so, examples of this can be something as simple as a one-door staff directory or a one-door point of contact at each agency that, is kind of specifically charged with responding to those inquiries. That would, of course, have some short-term inefficiencies, but it's just an example of we can do something today. It's about building out referral protocols. Did they call you back? Your appointment for XX place is set for, July 15th. And it's using kind of a shared work journal, or it can start as simple as a spreadsheet, some kind of digital file that both the participant and the coach have, where they can kind of see all of the services that they've applied for or have applied for. And then, of course, tracking all their barriers in terms of, they still need their birth certificate or this or that. And so this coaching model as a one-door strategy is actually being used in other states. It's not just a concept, but something that's being done right now. These are 3 other states that interestingly, they use third party for their coach models. They don't, hire directly within agencies for their coaches. And so Tennessee funds community-based organizations that serve as coaches. Texas, through its Workforce Commission, partners with local boards and nonprofit service providers. And then the state of Washington uses community-based non-government navigators as coaches. And so from all these 3 states, we can learn some kind of best practices for how to do third-party coaches. All of the 3 states paid for performance and outcomes. They required all of their coaches to use a singular case management tool that tracked all the critical things, like timestamps, when they referred, what's actually happening with these referrals. They got a separate group. So, for example, Tennessee got the University of Vanderbilt to continuously evaluate these coaching organizations to see how these coaches or organizations were actually doing. So it was a lot of transparency for everyone to see their dollar investment at work. This is an example of how one-door coaches could be evaluated for performance and not just volume. So, the actual percentage of participants that went to multiple coaching sessions, how many of them were employed within 90 days, how many of them completed, certain key applications, did we resolve barriers, what's their satisfaction? And then on our side, did our agency actually follow through when they were referred by a coach? So applying this to Mississippi, if we were to consider this or pilot this, it's key that we create a standard performance framework, use the shared front end system, whether it's a spreadsheet, whatever it takes to track cases. We use milestone-based payments, and we consider a neutral evaluator and just provide a lot of transparency. We could quickly start with 2 or 3 counties, an urban county, a rural county, a mixed urban-rural county, train them in, these core services and how to refer, assign them, 20 to 30 individuals, and then, really evaluate and incentivize performance.
And then we wanted to just touch back on, okay, so if we have these coaches and they're trying to connect people with the services that they need, the foundational services that they need to pursue work. So thinking back to social determinants of health, or also social determinants of work, things like stable housing, mental health, physical health, sufficient childcare, sufficient transportation. All those things are the pieces that surround, somebody being able to not just get a job, but keep a job too. So what are the things that we could do to also make sure that the social support services that exist in our state are where they need to be, are actually achieving what we need them to achieve? So that's another piece. You can't just stick a coach out there and say, send them to the services, unless you really know and believe those services are where they need to be and are doing what you really need them to achieve. So some questions that might be useful to ask: where are the services located geographically? Does service provider capacity meet the need? So an example there to me is something like HUD vouchers. There's two pieces to that. Is a voucher available, and is there housing that will accept the voucher? It's not actually enough to get the voucher. You also have to have a place to use the voucher, right? So that's a piece there. Is the capacity really meeting the need? Are providers tracking meaningful outcomes? Do we know if they're successful in key metrics? And are services available in name only, or can they truly be accessed in a timely and meaningful way? If you have to wait 6 months to get this service, is it truly available to you, right? So really digging into some of those pieces to set those coaches up for success. And then you also are able to use the coaches as a source of feedback, right? They're on the ground, they're working with people, and they can help you know, where are your gaps in services? Where are there things where I can send this person to this service all day long, but it's actually not making a meaningful difference for them? And where am I sending them to a great service that we need to invest in, that we need to help them expand what they're doing and serve more people? So kind of in conclusion, we think that Mississippi has a strong network of things to leverage, right? Strong community colleges, strong workforce programs, a lot of people who really care about this work that we can really leverage. We want you to take away that one door is one relationship. Whether that's a digital thing, whether that's an in-person thing, how can we help move toward one relationship? And building those human relationships, case plans, and workflow protocols first. Don't wait until you have to do all this data navigation and getting all these systems aligned. You can start here. You could start with this one relationship piece. And then that we can also be a wise purchaser of interventions. So really establishing strong frameworks for evaluation and doing pay for performance, not just volume, but making a meaningful difference. Okay, so I think that that's the conclusion of our presentation. I'm glad to take some questions now or later.
Thank you. I think based on the way we've kind of set the agenda up, as much as I like to ask questions as we go, I think we're going to save that so the entire committee can ask questions, and it may be kind of a rapid fire situation. It's 9:37. We'll take a very brief break if people want to maybe get a cup of coffee or step to the restroom. Try to be back around 9:45, but we'll get started back as quick as we can. I know there's a men's room right here. I don't think the ladies' room is functional here, so you may have to go to the third floor or the stairwell on every level, but it does switch depending on which level you're on. The men's room or the women's room is on the opposite side.
That was like, I was gonna run right here. Like the men's stairwell. Love that. Love that. Like 3 hours sleep. You're like, I see the counter breaking out. Like, tastes so damn good. Look what I keep in the bottle. You get desperate. Every time I see a video of one, I'm like, is today the day of this door dashing, the Sam's Club version? Yeah. I never thought about that. Amateur. I know. That's what 50 cents an ounce. Look, I'm telling you, you can't beat Sam's Club. Did you like clusters? I did. Okay. Yeah. Just do the per ounce cost instead and let me know when they are. So I'm searching. Where's the cheapest place to buy it? I'm just like, my current theory is Sam's.
No, I
think it's gotta be. In the front? Yep. Oh, I've been live text. Gotcha. I really. Well, I wasn't sure. I was kind of proud of myself, like I was like taking notes. I'm studious right now because it's 9:30. By 10, I'll start texting people. Like, Chris, what do you think it's like? Back with the writing. I was very. We're like, hey, like 30 minutes. That's fine. Ooh.
Well, we will go ahead and start back in the interest of time. Next to present is Mississippi Department of Human Services, and I'll let you introduce yourself and proceed as you please.
I'll do that again. Good morning. I am Shanetta Drone. I serve as the Deputy Executive Director of Economic Programs at the Mississippi Department of Human Services. Courtney asked that I share what our client experience is like for those individuals who do have a work requirement for two of our assistance programs. Each of you should have a one-page handout that summarizes the two programs at MDHS, or two of the programs at MDHS that have a work component. So first, I want to provide very simply information about our temporary assistance for needy families cash assistance programs. Families are required to apply, and they have a few options on how to submit an application. They may apply online through what is called the Common Web Portal. They can submit an application or applications to MDHS or once a applicant is determined eligible for TANF assistance, and I want to use a family size of 3 as an example. The family of 3 must have at least one child in a home. That is a requirement of TANF. The maximum gross annual income limit for a family of 3 is $12,888. That means that the income coming in for an entire year for that family cannot exceed $12,888, and they be eligible for TANF. The monthly cash assistance amount for that household size of 3 individuals, including at least one child, is $260. If an adult in that household is determined to have a work requirement, they are enrolled in what is called the TANF Work Program. As of June 30th, 2025, there are 151 participants in the TANF Work Program. Now, I want to contrast that number with the total number of TANF recipients we have on a monthly basis. There's approximately 2,289 active cases per month on TANF, and only 151 of those participants have a work requirement. And that is because the majority of our TANF cases are children only. Now, although there are 151 TANF Work Program participants, there are a couple more hundred individuals who could have had a work requirement, but they met an exemption. And I think it's important to share what an exemption could look like for a TANF recipient. One is if they are disabled. Anyone who has a disability does not have a work requirement under TANF rules. If a mother is in her 3rd trimester of pregnancy, during that time, she does not have a work requirement. She would also not have a work requirement until the child reaches the age of 1. If there are other medical reasons, and we do require documentation from a physician, but we also contract with a medical reviewer who is a physician who has to review any medical exemption request, and that individual has the final decision on whether or not that person meets the medical exemption requirement. If you are a recipient of TANF and you participate in the TANF Work Program, child care vouchers and transportation stipends are also provided. And the reason for this is TANF is not long-term. It is literally temporary. And the goal with TANF Work Program is for them to no longer need TANF assistance if possible. And we recognize, or within the TANF rules, we are able to provide some supports. And so childcare is a support as well as transportation. And an example of the range for transportation vouchers, they can receive anywhere between $120 to $300 per month, but this is based on the number of hours that participant is required to do. And by hours, that could look like, as an example, how many interviews or how many hours have they spent actively job searching? Are they in an education or training program, for example? Are they volunteering? So for our MDHS, we do have a county office location in all 82 counties. 2 counties are fortunate to have 2 locations. Don't ask me the logic, I met them like this. So we have 84 offices. And each of our county offices, they do explain the TANF program. They explain the TANF work requirements if it's applicable to that household. And if that household decides, because they could say, and many do say, no, I do not want TANF benefits at all. And that is their right. But if they do decide that they want to continue on the TANF work program, then our county office staff, they conduct an orientation. They do initial assessments, and then they are referred to MDES for case management. And that case management can look like, or does look like, supportive services. They identify what supportive services does this household need, and they make all attempts to connect them to those needed services. They also assess work history, school history, what are the gaps or what are the needs, and then they place them in what is considered a component. Now I'll transition to SNAP, our Supplemental Nutrition Assistance Program. For calendar year 2025, we have an average of 362,423 cases per month that are active across the state. Using the same family size as an example, for a family of 3, the maximum gross annual income is $33,576. The maximum benefit amount for a family of 3 is $768. And what's important to note here is that is the maximum SNAP EBT benefit amount. That does not mean that every household that is a size of 3 will receive the maximum. It is, yes. Based on income, assets, can impact how much they may receive monthly. So under SNAP, there are 2 groups. One is considered a work registrant. And those are individuals age 16 to 59. And I stress today because due to recent federal changes, the ages will change to 18 to 64 for work registrants. They are required to have a minimum of 30 hours per week that they are working, or they earn $217.50 per week. Several work registrants, when they apply and they are approved for SNAP, they are already working, and they are typically considered work registrants. Our able-bodied adults without dependents, for the most recent month, we had 15,431 individuals that are classified as able-bodied adults without dependents. For that particular group, the current age range is 18 to 54. It will increase to 18 to 64. And what you will note is with the recent federal changes, it's making the age range for both work registrants and able-bodied adults without dependents exactly the same. So for any individual that's aged 18 to 64 would have work requirements. And this is where it gets a little muddy. And it is, you can be a work registrant and not considered an able-bodied adult without dependent. You cannot be an able-bodied adult without dependent without being considered or first determined to be a work registrant. So for your able-bodied adults without dependents, and in my world, we call those ABODs, they are required to have a minimum of 20 hours per week that they are either working, in school, or volunteering. An exemption today for the ABOD requirement would include homeless, children who have aged out of foster care, and veterans. That will change in the coming months, and they will also have to meet work requirements. We do require that both our TANF work participants as well as our able-bodied adults are registered in Mississippi Works. Any state that operates a SNAP program is required to have a SNAP education and training program. Mississippi is, at one time we were one of three. I believe now we are the only state in the country that is a mandatory work participation for SNAP ENT, which means that a client cannot opt out. They are required to meet the requirements of SNAP ENT. And our approach to SNAP ENT currently in Mississippi is Skills to Work. We do have partnerships with Hines Community College as well as Refill Jackson, where SNAP recipients who are, example, enrolled in Hines Community College, their tuition, a portion of tuition can be reimbursed using SNAP dollars, as well as some of the staff's time and effort for the SNAP ENT program is reimbursable at 50%. Our workfare partnership, throughout the state, we attempted, and I say attempted as past tense because our federal partners recently required that we remove the workfare component from our SNAP ENT plan. We do intend to add it back in October. Our workfare partnership is at the community level. It is identifying local businesses who are willing to accept referrals of our able-bodied adults without dependents who are job seeking. And the federal government does require that we have a contract of sorts with these entities where they agree to allow our clients to come in a minimum of 20 hours per week to either allow them to volunteer or to actually hire them at a minimum of 20 hours per week. One of the reasons you may be wondering, why would the federal government make you remove something that sounds so wonderful? Opportunity that we have is, and a challenge depending on your perspective, is that we do not have, or we did not have, a lot of workfare partners. A lot of local businesses, when they hear that these are SNAP recipients, are concerned, and they are not willing to enter into an agreement. Some of that is marketing, and that's one of the things that we're looking to do a little bit differently in explaining that first, they are not SNAP recipients. These are local community members who are looking to work. And we want to see if that could change some of the temperature with a lot of businesses on being willing to accept our clients. And I'll actually end on expanding what I did label as opportunities. We have an opportunity as a group and obviously as a single agency to improve access to work opportunities in work deserts across the state. Acknowledge that the TANF specifically, cash assistance amount is low, the requirements are high, but we can highlight what is possible if the TANF work program and SNAP education and training programs are maximized. That yes, there are a lot of things that we ask recipients to do, and there are a lot of hoops that they have to jump through for us administratively. But if we can highlight for them that this is just for a short amount of time, that if you do XYZ for 2 years, for example, and at the end of that 2-year period, you have a degree, your opportunities are totally different and you can change potentially the pathway for your entire family. Recruitment of more workfare and SNAP education and training providers across the state. One of the biggest challenges, as I mentioned, with our workfare partners, but it's also true with the SNAP ENT providers, We are very lucky that Hines Community College, for example, has been willing to take on the administrative burden of operating a SNAP ENT program. Not all entities have the staff to be able to do what is federally required of them to do. And I do view that as an opportunity for this group and maybe identifying other organizations that we could potentially recruit or talk to about becoming education and training providers as well as workfare providers. Thank you.
Thank you very much. Certainly have some questions when we get to that portion of the program. Up next is the Mississippi Community College Board, I believe, addressing adult education. And Kel, I will let whoever on your team, I'll turn it over to you.
Thank you, Mr. Chairman. Is it okay if we sit right here instead of the hot seat? Okay. Hey, thank y'all for allowing us to come and visit with y'all this morning on community colleges and specifically adult education. So quickly, I'm going to just kind of paint a broad overview of who we are as an agency, the opportunities the colleges provide, and then turn it over to Rachel and Bronwyn to go into further detail about adult education efforts. I feel like that's the most pertinent topic for today's conversation. So the 15 community colleges serve, north of 110, 120,000 students each year in academic, career, and technical education opportunities, non-credit workforce training, and then adult education as well. At the agency, we're the coordinating board for the state's 15 community colleges. We have 38 employees. Some of our responsibilities include verifying student enrollments each semester, dispersing state dollars that the legislature appropriates this fiscal year. That's about $292 million. We have a role with career and technical education. We approve those program offerings, those program locations. We oversee student organizations for career and technical students, which is very important in exposing them to trades and for industry to see their skills. We facilitate curriculum revisions and writings for career tech programs. That's really important. The last thing we want to do is for a student to go through a career tech program, be hired, and what they're taught doesn't align with what they're needed and skills are needed in the workforce. We also oversee aspects of the virtual community college. That's our online learning tool. It enabled us back 5 years ago when COVID hit to transition to an online delivery method, which was critical to continue our educational opportunities for our students. So that's kind of who we are and what we do in a nutshell. Here today, though, to talk to y'all more about adult education. That's our role as a WEO, a core partner in the state. In Mississippi, we have about 330,000 people without a high school equivalency diploma. Of that, I believe about 216,000 fall in that working age population of 18 to 64. So you're talking about a significant number of people in the state who oftentimes are caught in this cycle of poverty. So funding for our adult education efforts comes from several sources. We receive, or we were set to receive, about $6.49 million from the federal government as part of the Adult Education Family Literacy Act. That's called AFLA. In education, y'all know we love our acronyms. The legislature provides about $1.8 million in general funds. We get another $3 million for dropout recovery efforts from the legislature as well. This fiscal year, the legislature provided $450,000 to cover the tests for high school equivalencies. The colleges don't charge students for the tests, and then our agency will reimburse those based on money that is provided by the legislature. And then additionally, this fiscal year accelerates providing, I think, Courtney, about $2 million in basic skills for those entities who are approved. So all in all, I think about 13.69 is what that comes to. Last Monday afternoon, I received an email along with Beth Little, our state adult education director from the U.S. Department of Education. All states received it saying that they are reviewing federal adult ed grant programs, and decisions have not been yet made about the awards, in essence freezing the funding that we were set to receive, $6.49 million, beginning the following day. We've notified our partners of this, various federal and state leaders as well. We've met internally, and we've identified about $3.1 million that we're able to provide our partners right now. That comes from the general funds the legislature provides. Then also we had we think about $1.65 million in federal carryover funds from this previous fiscal year that we're able to provide as well. So later this week, we'll be sending out our information, revised contracts with those amounts to our partners. So that is definitely a challenge and an issue that we became aware of first part of last week, but wanted to make sure y'all were aware of that. I'm going to now turn it over to Dr. Rachel Devon Partrick and Bronwyn Robertson to go over our presentation. Y'all should have a copy, I believe, in front of you and also on the screen as well.
We've given y'all a PowerPoint that y'all can follow along with us and take it back with you. So Kel's gone over the funding part of that. On the next page, you will see just understanding who Title II is, who we can serve and who we cannot. 16 years or older, they cannot be required or enrolled in a K-12 system. If they do fall within that compulsory school age, they have to have a withdrawal notice. We do service those that do have a high school diploma. We have those that are coming into us. Maybe they're trying to get a job, upgrade their skills, but they are below a 9th grade or an 8.9 grade level in reading or math. So we can service those that come into our programs that way. All of our services, as Kel just mentioned, and we're so fortunate for the Senate bill to allow high school equivalency testing, because that has been a huge barrier to a lot of our constituents across the state. But all of our services are free. Our students do not pay for a pencil. They don't pay for any paper. They don't pay for any software they use. Everything that you see, even to the college and career navigation. Y'all know across the state, career coaches.
Right.
We have college and career navigators that we've had in all of our adult education programs, probably since about 2015, that provide those transitional services to our students. So we hear all the time in Mississippi, a middle skills gap, right? We don't have the skilled workforce to fill those middle skill jobs, right? Well, we have a real skills gap in Mississippi, as Kel just mentioned, of not having a high school diploma. And so you will see, I've given everybody in here a handout. It's a green handout of the Mississippi map that NSPARC did for us. We got this probably about maybe, I don't know, less than a year ago.
Right.
And you can look at your county to see your high school dropout rate. And it's from 18 and older, 18 to 24. It's just different ranges there. And so you will see the population in your area of the needs that we have. And so when you talk about funding being cut, it's going to be a lot harder for us to service these individuals, but we're not, going to stop there. 90% of the individuals that come into our program read below an 8.9 level. A lot of people, I would probably say 83% of our students come in that are dropping out between the 9th and 10th grade. Okay, that's where they're dropping out.
Right.
But that does not mean they read or do math on a 9th grade level. We're looking at more of a 6th grade level. And we're measured on a year time frame. So we're measured not over a 4-year graduation rate. We're measured on year to year, starting where we start with our students July 1 to June 30th, which is where wraparound services and connecting to core services throughout our state is vital, because our students can't read and they can't do math. And so they may not have transportation, they may not have childcare, so those type of services.
And I think I want to stress here as well, many of our students who come in at that 8th grade or lower level, it's hard for them to start receiving employability training if they're not able to read and write at that level. And so it is more than a year. These students, many of them are enrolled more than a year, simply because they've got to go back to those basics where they are deficient, bridge those gaps before we can introduce employability training. So it takes a little longer for our students than maybe it might with others.
Right. And just to let you know here too, 30% of our students are 16 to 17-year-olds. Those are not on the Census Bureau. So when you're looking at the Census Bureau, wanting to know your high school dropout rates in your state, or those that don't have a diploma, you've got to take into account they're only measuring from 18 and older, not our 16 to 17-year-olds.
And yet our 16 and 17-year-olds, like Bronwyn said, account for 30% of our annual enrollment. They're just not falling under us from the Fed's point of view. They're not tracked.
Right. So how do our programs hear about us? We really had to do a mindset shift in Mississippi, not starting with partners, but starting with our adult education programs. That's where Skill Up Mississippi comes in. You probably know us as a GED program, but we now have 4 options for you to be able to get your high school diploma. It is no longer walking in our door and getting your GED. It is so much more than that. And so we have 18 programs. We're in the 15 community colleges. We are in 3 K-12 systems that we provide funding to. And students learn about us really honestly. I know that we have a referral system in our state that we're all to be using, but I'm going to tell you referrals are all over the map for us.
Yes.
We are getting them from community-based organizations. We're getting referrals from drug court. We're getting referrals from our core partners, of course, but it's really boots on the ground, word of mouth, where we're getting our constituents. Also, we have a website, skillupmississippi.com. We watch that traffic to see who's coming to our website, because you can go to skillupmississippi.com, click on the county that you live in, and it's going to bring up, if you're in, say, Leake County, it's going to bring up Frida Thompson, the Director of Adult Education, with her email, website, phone number. So it's easy to get into there and find that information. In the last 30 days, we've had around 1,057 new visitors to our website. We are tracking that, listening to MDES talk about the different digital access things that people are using. 51% are coming to our website by mobile device, which means our students are coming specifically looking for something. And at the end, you can tell they're looking on how to get your diploma, how to get their transcript, because they're trying to do something, okay, and high school equivalency. So we've got new visitors, 94% of those were new visitors visiting our website.
I also want to add too, this next school year, we've reached out and partnered with K-12 school districts. And annually, those students are enrolled online or however that school district chooses to re-enroll those kids. We've reached out now where we've added 2 additional questions in that intake form for parents of those students who are enrolling, giving them the opportunity that if they do not have a high school equivalency and are they interested in someone from one of our programs reaching out, to click yes on that. Someone from our office receives that information from the school district, and our local programs are now reaching out. We've recognized that it's important to approach this issue with basic skills deficiency from a 2-generational standpoint. We know from our research that many of our children whose parents have not completed education have fallen behind academically. And so we are looking at ways to go into those K-12 systems and start grabbing those parents, allowing them the opportunity as well to complete whatever is necessary to make their students successful.
And that's something that you want to do. You want to do something at no cost, right?
That's right.
Something that's not going to cost, building those partnerships is not going to add any more cost to our programs to do that. So what does a student's journey look like in adult education today? It's totally different. Like I said, before WIOA came around, it was totally different. It was get your high school diploma and good luck to you. When adult education Title II got thrown under a workforce act as WIOA, I believe that honestly, we're probably out of the core partners, the ones that had to change the most, because now our students are measured. It's measured on where are they when they leave us. So we had to be very intentional to change the mindset of adult education in our state. And so they come in and they go through an intake orientation process. It used to be you take a TABE test right at the very beginning to look at your grade equivalency. Now it's about pathways. Now it's about introducing our students to what pathways are offered there at that site, at that program, or at that college. And then it's one of the very first things that we do, we're very proud of this, is that we make sure that all of our students are connected to Mississippi Works. We started that back in 2017 and 18. We made sure that they have, so every single one of our students, we make sure they have a confirmed, active Mississippi Works account. That's one thing that we've started. And then they go into an assessment. What's your grade equivalency? And I won't go through all of this, but going down to our college and career navigators That is where referrals really are probably going to take place with our students. Our students are not going to disclose to us in the first 2 days that they need transportation, that they need childcare, that they're homeless, that they're a foster aging out. They're not going to disclose that. So there's got to be some trust built there. That's where employability skills come in. We did revamp our employability skills class back in 2019 to be Mississippi focused. We use exactly what economic leaders in our state are telling us, the job sectors. We are very supportive of that. So our students and our teachers, they know about the area they live in. If you're up in Northeast Mississippi, it might be totally different than what they're needing down at Gulf Coast Community College or our Pascagoula Adult Learning Center. So we want our programs to know that. And you'll see at the end there, it's all about getting them to workforce. That's what it's all about.
I think too, our federal outcomes include a lot of workforce data.
Yeah.
Where our students, their income prior to going into adult education and upon leaving that program, we're measured just as our other partners with WIOA on that. We do know the economic impact for our students prior to and after receiving their high school equivalency is an annual increase of approximately $9,400 a year. Based on the number of individuals who've completed in the last year or two, you know, we're looking at millions of dollars of revenue that's come back into the state for that. So we are excited and we are proud of that work there.
And that's $9,400 between a high school attainment
That's right.
and getting your high school with no college.
That's right.
That's the difference in the income for your state. So $9,400. And if you look at adult education, actually being your highest, your largest, you know, high school in the state, to be quite honest, we put out 2,065 high school diplomas last year from July 1 to June 30th. So you multiply that times 9,400. You know, so that's, you can do the math on that for the revenue for the state. So let's get into this right here. Like I said, we changed it to education, employment education focus. That's what we're doing now. This is a real pathway that's at Jones College. It's one that several of our students have already been through this past year. One just completed. We're so excited for it. And this is where ideally how adult education has changed is that we are now sitting at the table with CTE, workforce development, and an employer to design a pathway. And this is a welding pathway. We just had a student to go through this. He was in adult education at the same time that he's in workforce or a workforce class. And so just imagine not having your high school diploma and being told, hey, you can enroll in a workforce class without having your high school diploma. You can be dual enrolled. He got welding essentials. He got the work keys, which was a requirement to get into the short-term workforce 16-week program. He went through that, got all those credentials in that second step, still did not have his high school diploma, moved on over into the total transcript. So they called him between second and third step there, second and third box, and said, hey, the Community College Board just approved, we're very excited about this, allowing applied math and workplace documents to count as subject area testing. So you can now, if you want to come back and try to take workplace documents and try to get a silver, that will count for your GED or your HiSET reading and language test, if you want to try that. The guy came back, took his workplace documents again, scored a silver, has a high school diploma. He is now going to be enrolled in Jones College welding CTE program. And for the things that he's done in the first and second steps, they're going to do prior learning assessment. So he won't even be in that welding CTE program for a full year. And so, but you can see he had two options because that employer was sitting at the table. He had two options. He could have gone on the CTE route, but after getting his high school diploma, he could have gone on to that employer. That's what it's about. That's how it's changed. And we're very excited about that. And our guy is actually enrolled in the CTE program, and he's going to be able to do prior learning.
I think one thing too, in recognizing the importance that WIOA has allowed us to shift our focus, at the College Board, we've approved another option for a student to earn that high school equivalency. And Bronwyn has done extensive work with ACT in the research side, crosswalking what the GED or HiSET math and or the reading language portions of those tests with the ACT work keys assessments. And so just a couple months ago, our office approved that as a new option. So a student can take applied math and or workplace documents, and that counts as 2 of those exams they've got to have for that high school equivalency. The other components can come from GED or they can come from HiSET. We've opened the door to remove whatever barriers were there for those students to have a much more successful outcome with obtaining that high school equivalency.
So let's get into working with other partners. So as I mentioned, we make sure all of our students have a Mississippi Works account. We did have a referral system called Mississippi Adult Education. It was the MACE system that was built for us by InSpark. We actually have been using Mississippi Works as our referral system because we were noticing that we had students, when we were signing them up for Mississippi Works, they're asking, y'all remember those original diagnostic questions that we all had to come up with for referrals? They were answering those questions, and I might be the teacher helping Robin sign up for Mississippi Works. Well, what happens when she answers that first question, do you have a high school diploma or not? She pops into my queue as a referral from MDES. So we're sitting there going, well, if we're going to do that, let's just make sure all of our students have that. So that's what we've been using as our, to be quite honest, our digital initial referral for our students. Now we are using the MACE system for incoming referrals to some degree, but we're noticing that some of those are not very, and I don't want to use the word good referrals, but they're missing information. So we're having to close out a lot of those. So going back to what I mentioned earlier before with referrals, our referrals are kind of all over the place. And you're talking to someone that did referrals. I was over referrals when I was at Holmes Community College sitting in a WIN Job Center. I was the one referring to DHS and DRS and DES. And so, you know, we've gone back to that personal touch, that local level personal touch on referrals. We do know though, and this is one thing, we do have to track under WIOA our students that are co-enrolled. That means they're getting a service at a core partner. So InSpark data matches this for us. So we know that 73% of our students this past year, we found that they were in Mississippi Works. 27% actually received a service through MDES. Now, we don't know what service that is. We can't tell you what service they received. And the same thing with DHS. 18% of our students we know were co-enrolled receiving a service through the TANF or SNAP program. The one data point that we don't have, and we think it's a high data point, we just don't know how to get it. And I'm so glad DRS is here today. We don't have that data point on how many of our students are co-enrolled receiving services with the Department of Rehab Services. And that's something that we would like to really kind of bridge that a little bit better there. And we only get this data one time a year when we have to federally report. So would really love to be able to see this on a more maybe day-to-day basis or quarterly basis where we can really see what our students are being provided. And so going back to outcomes, I think I went too far here. I think y'all mentioned outcomes. Let's see. I'm on the last slide here. Why is Title II important? Okay. So 44.7% of those without a high school diploma, your workforce participation rate, is 44.7%. So right now we're sitting at a state around 56.2%. For those without a HSE, that is the rate for them. We had InSpark. We wanted to see where all of our students were. As Rachel mentioned, we do have to measure our students when they leave us. So 60% of our students left us after they exited our program, they were employed. 72% were still employed 3 years after exit. 5 years after they're exiting us, 76 are employed. So we follow them where they are 7 out of 10 of our students enrolled in My Best are earning their HSE. That's that in dual enrollment program. That 6 out of 10 of our adult learners require some type of supportive services, which comes back to this one door mentality of where we're all providing those wraparound services to our students. And then just going back to what Rachel mentioned a few moments ago, the impact of having a high school diploma.
And I think too, some of our numbers here, Bronwyn and I, we've been looking at this. We've got 127,000 based on our data that are 18 to 64. So in that workforce age range without a high school diploma and are unemployed. And so that's low hanging fruit for us in our programs. That's why so many of our options are, they've become much more geared for that employability side. So our students are not spending a couple years in an adult ed program, which many of them require to bring them up from that 5th or 6th grade level up to that 10th, 11th, 12th grade level, so that they're able to pass those high school equivalency exams and or be prepared with digital literacy, those applied mathematics skills, et cetera. That's our low hanging fruit. That's where our adult ed programs are focusing. And then as far as the youth without a high school diploma, not enrolled in school and unemployed, again, we don't track 16 and 17-year-olds, but 30% of our population falls in that age range.
Mr. Chairman, that concludes our remarks today. I do want to add that Beth Little, our state director of adult education, was going to be here, but she had something to come up and she couldn't get out of that. So, or else she would be here with us. Thank y'all for the opportunity to share with y'all adult ed.
Thank you, Kel. We'll move on to Department of Rehab Services. Billy, you have the floor.
All right, thank you, Mr. Chairman. I just wanted to start off by saying how excited we are for our seat at this table, being a core partner in the state's workforce system. We really do feel like there's some room for improvement for how we deliver services to Mississippians looking for jobs. So excited to have these conversations and to really figure out where those improvement areas are, figure out how we can get there. Just a real quick overview of our agency. We look at ourselves as the state agency for Mississippians with disabilities. We have about 950 employees, 45 offices around the state, and we're funded with about $250 million annually, 34 million of that coming from the state. So real quickly through our programs that we offer, we have 4 what we call major programs, 2 of which are workforce related. Then we have some that are non-workforce. So our 2 major workforce programs are vocational rehabilitation and vocational rehabilitation for the blind. So those programs are designed to help people with disabilities get into the workforce or to remain in the workforce. And those are funded through mainly a federal grant. It's about a $65 million grant. It requires a state match. So of that $65 million, about 50 of it is federal dollars and 15 million is state dollars. And that all flows from the Department of Education through the Rehab Services Administration. State match rate is 21.3% on that $65 million grant. Then our non-workforce programs, we have the Office of Disability Determinations, which that's a partnership with the Social Security Administration. It's 100% federally funded. And that's where we process all of the disability claims for people that are applying for disability benefits through Social Security. And then we also have what we call the Office of Special Disability Programs. And that's kind of our independent living arm of the agency. So these are for individuals with disabilities that are not looking to enter the workforce, that are trying to just remain living independently in the community to the fullest extent possible. The 2 major things we do in that program is operate a couple of the Medicaid waivers. We have the independent living waiver and the traumatic brain and spinal cord injury waiver. All right, so I know the focus of today is on workforce. So you notice I didn't really dive into too many details on the non-workforce programs, but I wanted to really drill down and talk about just our VR and VRB programs. That's vocational rehab and vocational rehab for the blind. And in those programs, the goal for those is to help people with disabilities find competitive, integrated employment. That's kind of the key phrase we're looking for and what we're trying to accomplish. So eligibility for those programs, that's a often talked about subject and very, very important. So in order to be eligible for our VR programs, you have to have a disability that results in a substantial impediment to your employment goal. So that word substantial is important. You know, we have counselors around the state that have to make those decisions of when somebody does in fact have a substantial impediment to their employment goal. So like I mentioned, the counselors around the state, they're kind of the backbone of the VR agency. These are individuals that went to college, got a degree in vocational rehabilitation counseling. Many of them have master's degrees in that field. They have it's called a certified rehabilitation counselor, like a special designation. So these are, I feel like highly trained counselors that they are helping individuals and trained to help individuals enter the workforce and to kind of overcome the barriers that their disability may bring to their life. And one thing I think that's important to point out is, we get this $65 million grant from the feds, but it's not like a block grant they just give us and say, go do your best serving Mississippians with disabilities. We have a very stringent set of federal regulations that we have to follow. And not only do they prescribe the federal regs, but they're very diligent in making sure we abide by those federal regs. They actually are coming on site here in Mississippi a couple months. They're doing a big audit of our state. They kind of rotate different states in our region and come on site and make sure we're abiding by those regulations. And we have a call with them this afternoon at 1 o'clock. So I wish they would give us the money and we had a lot of leeway to just do what we thought was best. But unfortunately, there's pros and cons to it, but we have a playbook we have to abide by, which is that set of federal regulations. Like one example that comes to mind is like whenever you're determining somebody eligible for our services, the federal regs say that's a non-delegable duty. Like that has to be done by a voc rehab counselor. The feds say we can't hire a third-party group to make that eligibility determination, or we can't say, hey, adult ed, could you guys tell us if these people are eligible or not? That's a duty that has to be done by the designated state unit, which is our agency. So I think that's an important thing to point out. All right, and this is our basically how we serve individuals. This is their path to employment. And we have some timelines laid out here, and a lot of these are prescribed by those federal regulations I mentioned. So this is the maximum amount of time we have to do each of these things. So you'll see after we get a referral, we have 14 days to make contact with that individual, to set up that initial meeting. Then within 30 days, we have to complete the application. And then once that's done, we have 60 days to determine eligibility. So that's sort of a complicated process sometimes because we have to request medical records and sit down with the individual and make that determination. And it's not as easy as just looking at a W-2 and what's your income, okay, you're eligible. It's a really holistic approach to this individual's life, looking at their medical records, looking at their work history, and figuring out if, going back to that definition of eligibility, if that disability creates a substantial impediment to their employment goal. So that's where that decision's made right there in step 3. Then step 4 is developing the individualized plan for employment. So this is really where the work gets done by our counselors around the state. They develop the plan for employment, like, all right, what's your disability? What's your impediments to your employment goals? And how can we overcome those? Do you need any kind of special assistive technology at work? Do you need more training? Do you need counseling and guidance? Do you need some advanced degree paid for? Is that standing in between where you are now and your employment goal? So that's where the crux of our work is done right there in step 4. And then the good part comes in step 5 is where they find that employment, or they keep that employment. So that's kind of the sweet spot of our process and what we like to get to. And then after they have reached their employment goal, we keep that case open for an additional 90 days just to make sure everything's going okay. We try to get some wage records to report to the feds. That's basically our path in a nutshell. Next slide here. So we talked a little bit about the some of the other core partners talking about the access points. So we have, multiple access points. I'll kind of walk through them. We have a communications department that does a lot of community outreach, trying to get the word out to Mississippians, what vocational rehabilitation services are and how to access them. We have interagency agreements with the school districts throughout the state, really trying to focus on that transition age youth, people when they're transitioning from high school into the workforce or college into the workforce, requires a relationship between us and Department of Education to make sure we're serving those individuals. Number 3 is an interesting one. That's the SSA Ticket to Work program. What that is anybody that is receiving disability benefits through the Social Security Administration. And of course, SSA is trying to incentivize people getting to work, getting off the disability rolls and getting out to work. So they have a program called Ticket to Work where you can, if you're getting your disability benefit, you can take your ticket to work to any of these different federal services, our agency included, and the SSA will reimburse us for any cost that we incur getting that individual back to work. So we have a whole unit that requests those funds back from SSA. So we serve a lot of individuals already on the disability rolls. We're trying to get those individuals back into the workforce. That's yes, sir. Yeah, it's about $2 million is what we get annually through that reimbursement process. All right, then step 4 or access point 4 is just through our 45 offices around the state. We try to be involved in the communities and at the Rotary meetings and at the Chamber of Commerce and ribbon cuttings, just letting the business community know that if they have any needs for their employees with disabilities or potential employees with disabilities, that we're there to help fill those gaps. We also have 15 Ability Works across the state. What those are community rehabilitation centers. The whole goal there is to help people transition into the workforce by providing them some soft skill training, some actual work experience in a real job setting. We have contract work that we do around the state. For example, we build crab traps down in Gulfport for Academy Sports, and we package bullets for Remington up in Oxford, and we have built some caskets down in Brookhaven for a funeral home. So do real work out in the community that's needed. We put people with disabilities on those lines doing that work. That kind of gets them ready and figure out what they're capable of doing, what they're interested in. Hopefully they transition from that work at our Ability Works system into the workforce from there. Shooting houses in Starkville, yes, we do. Yeah. And they actually use the scrap wood from the shooting houses to build birdhouses. So they start with something big and then they, yeah. All right, and then on number 6 there, we have, I mentioned the 15 Ability Works facilities. We also have 2 facilities that are geared towards individuals that are blind. And we have a center at UMC's campus called the Addie McBride Center. New center we launched about 2 years ago down on the coast called the Emerge Center. So those are similar community rehab centers, but they help individuals that are blind transition to the workforce and learn independent living skills at those centers. And then our last access point is just through public outreach, our website, our social media campaigns, just trying to really get the word out as much as we can to the public about the services we provide. All right, here's some quick numbers on just client outcomes. You'll see there that the 2784 number on potentially eligible youth served. It's kind of a mouthful, but what WIOA wanted us to do, and when it rolled out in 2015, was to have a new emphasis on transition age children that aren't yet ready to enter the workforce or aren't looking to enter the workforce, but we have a good idea that they probably could need services from us one day. Maybe they're in this 14-year-old in the SPED program. So we have services that are going in earlier called pre-employment transition services. And that helps individuals just work on some soft skills and do things like career exploration, some work-based learning, some counseling on post-secondary education and what college may look like, some self-advocacy training, some soft skills trainings for the workplace. But they're not quite ready to enter the workforce yet, but we're just trying to, WIOA makes us designate a certain section of our grant providing these services to these potentially eligible youth. And you'll also see a number there for transition age students that are served. And these are slightly older students that are ready to enter the workforce. Maybe they're seniors in high school or finishing up at a community college, looking to enter the workforce. And that 2,900 number, they have fully opened VR cases. They've been deemed eligible for our services. And so last year we developed 4,209 IPEs, individualized plans for employment. And then we had successfully closed and competitive integrated employment of 3,310 jobs statewide last year. All right, so the fun part with the data sharing challenges. So, I mentioned we get a federal grant and all 50 states get the grant. And there's a couple providers of the case management systems for all of the designated state units around the nation. So the provider we use is a company called Alliance, and they run all of the case management systems for all the DSUs, designated state units around the nation. That's very helpful because anytime the feds make a change to the regs or have an upgrade, Alliance can just make it happen in the case management system, and all the reporting that's necessary to meet our federal requirements happens seamlessly in the background because our vendor is running the case management systems for all of the states. Most of the states, there is a competitor called Libra that runs some other states, but they're geared towards running case management systems for VR agencies. Well, when WIOA rolled out, we became a core partner. We were kind of having these meetings trying to figure out how can we work with the hub and that sort of thing. We built a crosswalk where our case management system would talk to the hub and make those referrals back and forth. Well, that worked great initially, but there were some issues with that. One, as the federal regs changed and Alliance started making upgrades to all the DSU's case management systems, our crosswalk started breaking down. Alliance was advancing their case management system. The crosswalk we built wasn't built in a way that it would naturally advance as the software is being updated. I think I'm explaining that right. So that was one of the initial challenges with case management system. The other challenge with the case management system is when we built the crosswalk, in order for us to initiate the work in our case management system, we had to get that Mississippi Works ID right. But we were getting so many referrals. This kind of goes into another issue with that initial question that y'all mentioned. The intake question for our agency said something like, if you have any difficulty sitting or standing or reading or seeing, hearing, if you have any difficulties in your life with those things, check here, check yes. So I think people, when they go into the DHS office and they're applying for SNAP or TANF or maybe a service, adult ed or employment security, they see these questions and they want those benefits. So they're trying to make life, and it probably is difficult, but they're trying to make life look difficult. And they're not really thinking, hey, I'm signing up here for a counselor to reach out to me and provide counseling services to get you over this hump of this disability that's affecting my life. So I think people are just checking yes, because a lot of people can say they have difficulty with those things, getting to work. And that was creating hundreds and hundreds of referrals, even thousands in a year that we would have to sort through. And when we would contact them, they wouldn't really be interested in opening up a VR case. They might not have an employment goal. Maybe they're already working and things are going fine. But it was just creating some challenges sorting through all those referrals. So we're hoping to find a way that we can kind of transition to getting, we're calling more quality over quantity, and maybe not having everybody that checks yes to that box come as a referral, but we're working towards rewriting that question to help people better understand that when they check yes to this, they're signing up to have a VR counselor reach out to them and open up a case to provide those services to them. Sure, I covered all my case management. That's all I can cover. So yeah, we've been working with NSPARC and the hub trying to get that process, back in compliance, making those referrals back and forth, the way they should be. But it's been a bit of a challenge getting from where we are now to where it ultimately needs to be. So I wanted to share just 4 recommendations I have to hopefully streamline the efforts of the core partners to develop an improved product to Mississippians interested in workforce services. So this would basically be either working groups or subcommittees, we could call them, that would maybe, I don't know if they report through, Courtney or to the SWIB directly, or the best way for that to work. These are 4 areas I thought that if we could form some committees that meet in perpetuity, not just a one-time thing, but let's have them meet continuously, maybe monthly, just really have the subject matter experts to drill down on some issues to figure out how to improve these particular areas. So the first one I wanted to mention was maybe we could have some kind of marketing or branding subcommittee of all of our, communications folks that can really figure out a way to brand the services that we have, to develop or to deliver like a cohesive unit of services to the public. Because I feel like right now, even when that picture was shown earlier, I think it was a Wynn Job Center, but it had each agency's logo, and it's just kind of like word salad on the door of all these different state agencies, and a little bit overwhelming for the public just to walk up and be like, this is just a lot to look at, and I don't really know which one of these I need to help me. I feel like if we had a way to really brand that in a unified way, that way when Mississippian looking for a job or looking to improve some skills, be like, hey, I need to go see Mississippi Works, to, whatever the phrase that we come up with, or maybe that is the phrase that we decided on. But I feel like if we had a group or a committee working towards that effort, we could see some good fruits from that. All right, point number 2, or subcommittee number 2 I wanted to recommend was just office space and physical locations. We have our guy at our office is named Eric. So Eric's in charge of procuring all 45 of our leases around the state for all of our offices. We have an office that needs to move or the lease expires or whatever. Eric just, goes through the DFA process, runs the procurement in the newspaper, looking for office space for 12 people, gets the lowest and best price, and we move offices. But Eric is not thinking at all about, hey, we're a core partner. Is there an opportunity to co-locate or be closer to some of these other partners? So I think if we had a working group of the Erics of all these agencies trying to co-locate better, and we've had some discussions. I've talked with Jason Pope over at Deployment Security, and we decided doing a tour of Parchment, and he mentioned that they're moving their Cleveland office. And I was like, yeah, we have an office in Cleveland. Let me get with Eric and see what our lease looks like there. Eric was like, hey, that building's terrible. The lease is about to expire. Like, we would love something different there. Now, Eric and Jason have been working together to get us located in one spot. I feel like we could deliver a better product to clients that we serve by being more centrally located. I think about it, I was talking with Courtney yesterday, and I used the example. I grew up in Gulfport, and when I was a teenager, I went to the Harrison County building. I don't even know what it was called, but I went there to get my car tag, to pay my speeding ticket, to get a driver's license, eat the jury duty. I had to go get a bonfire permit when our senior class wanted to do a bonfire. I didn't know like what door I was walking in or what office or who gave the permit. I just knew I had to go to this building and somebody would kind of get me in the right direction. And I feel like a lot of Mississippians are probably like that with their workforce services. Like they know they need help. They don't know exactly where to turn. If we could get them more heading towards one central location in their county or in their city, if we could get them in the building, we could be like, hey, we walk down the hall and see Laura. She'll be glad to help you file for unemployment benefits or whatever that may be. So I feel like that would be a good work group. I know that's not a quick fix. I mean, ideally, we'd like to have maybe 82 of these buildings all around the state open tomorrow and all in one nice new building. I know that's not going to happen, but I feel like that would be.
We used to have that. We used to have that.
Yeah. Yeah, I mean, that would be great to get there. I know that's probably a pie in the sky kind of thing at this point, but I do feel like if we had the Erics of the world in these 4 partner groups meeting monthly, maybe just having coffee once a month and talking about, hey, we have these leases coming up in this particular area. Y'all have empty space, or doing some long-term planning. Like maybe you have a lease that expires in a couple years and they have a lease expiring in 5 years. So maybe only do a 3-year renewal so y'all can end at the same time. So next time you're up for a new spot, we can maybe look at doing it more cost effectively and unifying those efforts some. All right, so working group number 3 that I wanted to recommend was back to that point on referrals. I think I kind of talked about that some, just making sure those referrals are quality referrals, that are people truly wanting those services and not bogging down the system with just these automatic referrals that every time somebody checks the box, it generates a new referral. But I think if we had and I know there's been a lot of conversations already about renewing those questions and making sure they are, doing the best job they can of directing traffic and getting people to the right agency in the most efficient manner. I feel like we had a working group. I feel like that's kind of like where we went wrong last time with the hub, is we set this thing up and then we let it run, but there wasn't like a constant nurturing of it to make sure that the kinks were kind of worked out as it ran. I feel like if we had a working group that was going to be set up in perpetuity, these people would be dedicated to constantly making sure those referrals are running in a consistent fashion. All right, and then lastly, I promise this is my last one, is number 4, and this is training for our core partners. And I think about it as our counselors around the state, it's hard to keep them trained on just the federal regs that we have to abide by. And it is mind-boggling to think if we would have to train them on all these nuances of all these different programs. But I think if we set up a group of, I've been calling it a working group of all of our core partners coming together and trying to come up with a real high-level, easy-to-understand training program for all of our employees to go through on a periodic basis. Maybe anytime we do a new employee orientation, making sure that we have this very well-developed delivery of training of what the core partners do, how to make a referral to the other core partners in a real high-level, concise, cohesive manner. I remember working with Laura, it's probably a decade ago, when we did the training for all the core partners at the Hilton. Yeah, that was great. Yeah, and a lot of work went into that. It was a great 3 days. But I mean, I think our attrition rate's around 15% at MDRS, or 15% times 10 years ago. Like, I don't know how many of those staff are still here. But yeah, it's just us. Yeah.
We're still here.
Yeah. Yeah. So I feel like if we had a working group that was always working on developing those training materials, coming up with a schedule to get that information in front of our employees on a routine basis, we could stay ahead of those attrition rates. But rather than doing like one big, great conference, which it was, we would have a way to really just get that in the folds of our agency's day-to-day training. Like I said, new employee orientations. We do quarterly managers training. So maybe once a quarter, we highlight a new core partner. I don't know what all the details of that would be, but if we had a group working towards that, I feel like we would see some fruits from that in the future. All right, I think that's the end of my presentation. Sorry, I kind of rambled through some of that, but appreciate y'all's time. Oh, yeah.
Thank you, Director Taylor. I'll just kind of look out the room. We're going to go ahead and let Courtney go and then have a break and then come back and do questions. I'm getting a lot of head nods. So Dr. Taylor, I'll turn it over to you with the Office of Workforce Development, also known as Accelerate.
Awesome. Thank you. I'm going to make mine fast because fortunately I don't have a lot of direct service that I have to talk about today. So I'm excited for that. So thank y'all for the opportunity to chat and be here today. I think, the purpose of this task force is not just to comply with statute, although that is need, but also to fundamentally rethink how we support individuals across the workforce and supportive services spectrum. We have a rare opportunity to lead in this way in the national conversation across the board, even thinking beyond the agencies in the room with our K-12 partners, with our community college partners on the training side, not just the service side. I say just, y'all know what I mean. There's a big, deep national conversation happening right now about workforce and human services integration. Everything that I have heard today in the room pretty much is the people are willing to integrate. Many times the regulations or the policy itself is what makes it hard to do that or to think about that, or people are just exhausted from the day-to-day and doing all the things and maybe don't have the mental time to stand back and look at that. So I appreciate this opportunity to have this group working together towards kind of this directed outcome. I appreciate the agency personnel, and I'm saying this for a reason, but I appreciate the agency personnel who spent hours with us. This is a really complicated system. The training side, I thought was complicated for years, but it ain't. I'll keep the training side. But the how we support people and what we're doing is, I think, unnecessarily complicated. And so I appreciate, y'all's brains and coming to the table constantly and trying to help us think through it. I think the next stage of this really has to be action, and pretty quickly. What can we act on, even if it's just one little thing? So, Billy and I talked a little bit about the training piece. Laura, we've talked about that. Kristen, we talked about that. We talked about, do we just put it online and have everybody create videos, not to kill people with PowerPoint and all that, but to make it something that people can actually get into? Because I can tell you, as someone who's not from Mississippi, it was hard to figure out this system and who's doing what and how to do it. And that's not a criticism of anybody. It's just how it is. So I think, as we think about the broader training and support ecosystem, we know it's fragmented. It's fragmented by federal law, by federal policy. I was in some meetings in DC 2 weeks ago, 3 weeks ago, I can't remember now, but a couple weeks ago, where they're encouraging waiver applications. They're saying just apply for waivers. And so I wanted to tell that to the agencies in the room. If that's something, if there's regulations that you think you can get waived and you want to, I would work within your groups to go ahead and get that done. And I would do that quickly. I don't know if they're going to make any fundamental changes to WIOA. It seems like the administration is working on just doing the changes they can make to the regulations, which fine with. But I also wanted to say, I think, from what I've seen in the system around the country, we're not unique in these programs. I mean, these are federal laws. There are states that got ahead of certain federal laws, so they're doing it differently. But we can't just go in and do that thing today. So it's, what requires policy at the state level, at the federal level, and what just requires regulation change, or for us to just challenge the system. So I would say, if there's things that we've been thinking, like, why do we do it that way? It doesn't have to be this way. Challenge the regulation and make them tell us that we have to do it that way. And then turn me loose, because that'll be fun. But I think, as an office, Accelerate, we've worked extensively on the training side of the house, more to get more streamlined program offerings of value, to kind of figure out where can we align things better. It's my natural skill set, so it's where I leaned in. I think moving towards this one relationship approach, like Claire recommended, I like that term. I thought that was really interesting. And so I think where we can do that, we should do that. I think, we need our training providers at the table. We've leaned in, with people like Robin Parker and CMPDD to try to help us coordinate some of this work and really streamline things. It's a lot of work, as y'all know. I think as we talk about the realities, and I've said this, but it's going to take some federal intervention. And so we don't know what's going to happen the next 6 months, as we've learned. We can be fairly confident in what's going to happen tomorrow, and learn tomorrow that it changed at 4:30 the day before, talking to the adult ed people who thought we were going to have adult ed money. But I'm not from the world where I think that's all bad. It's hard, and it's challenging, and it's unfair, and it's all the things. But I also think if we use this opportunity the way we can, it's that we look at the system, which we're all doing, take a hard look and say, what needs to change? I know, I have had, people randomly say, if you could change one thing about the system, what would it be? And I'm like, performance measures. I hate them. There's a lot more things that need to change. You can't just drop off performance measures. We have to have some measure, but, we're moving away from the system, at least from the state level and from the state funding, away from a system that's just high numbers, and moving towards, what's the quality that's happening. And again, I don't criticize what's happened in the past, because that's how it's been done as a nation. And so I think we're seeing those changes. I think it was some of y'all, the adult ed data, but looking at the long-term outcome, there are some measures that are approached for that, but we're kind of, at least from our office perspective, we're kind of in the world of, we're going to have to spend more money and serve fewer people, but those people that we serve, we're going to have to serve them more. I don't want to say better, but more. And I think that, to me, is the ultimate point of a task force like this, is how do we serve them fully with whatever they need, and put them on their way. And, I guess when your kids turn 18 and you're like, all right, hopefully 18, right? Like, you're like, all right, you're off the dime. You got to get off. You got to go do other things. And I think that's kind of what we have the opportunity in this opportunity in this world. I think, you know, it's disturbing, that at the federal level, that this, what I call the cattle call approach is not only encouraged, but it's required. And it's this, oh, we served, you know, X number of millions of people, instead of saying, you know, we did these 3 things for these 3 people. The other thing I have heard from every entity that has spoken in Shanetta, where'd Shanetta go? Shanetta, you hit me with this in one of the other meetings that we had, but you know, it sounds to me a lot like the people at the work level are craving this kind of intervention of whatever it ends up looking like. We need something different to do certain things. And so I think that makes it pretty easy if we can figure out what regulations we can waive, what regulations we can, you know, most of them are federal, you know, what regulations we can attack, and then where do we need a policy intervention? I think, you know, I would encourage us all to go back to our corners and do that. And I think as we talk about this system, moving away from a world where we make the people conform to the federal eligibility rules and towards the world where if the person is at your door, and there are limits to the funding, there are limits to everything, but if they're at your door, what all can we do to serve them, and know that we've done everything in our power to help a person that wanted it, and instead of maybe, in some cases, I feel like we're encouraged to go help people that may not want it to satisfy some check box that the federal government has. So anyway, there's a major national discussion that we've been a part of as a state. We're having it now. We got to keep doing it more deeply. I think we've got to, y'all have heard this already, we've got to continue to decrease the cost of administering these programs. That's not going to change until the feds change some of their requirements. I also have a personal problem with SNAP, not SNAP itself, but you know, recently in a meeting learned, you know, we have about $10 billion a year worth of SNAP fraud, not from people receiving SNAP. So this is not me saying the SNAP beneficiaries are the problem. It's by foreign actors, and the money's going to foreign countries. And so when I see as a nation, we're dropping, oh, we got to cut $330 million out of this training budget, I'm like, that's great. Can you just start with the 10 billion in SNAP? That'd be great. So again, not a criticism of SNAP and those things. It's just, you know, I think there's a lot of work we can do as a nation to increase that, and maybe shove some of those monies over to training so we can get people going in the right direction. Anyway, I think we have federal law barriers, as Billy detailed, some of those in kind of some worlds that we could move forward. But I also think we have some real deep opportunities. I think, you know, joint eligibility, it's impossible right now under the federal law, maybe the feds will change that, where we can look at, you know, how do we align this to make it better? How do we work better internally? And I know those conversations are happening. I don't think as entities, we talk enough about what we're doing together. And I know we don't do enough together. We do enough one-on-one. And so I think, you know, we're working to fix that. We're working to all do that better. And that's not a criticism of anybody but myself. But every time I've called y'all to the table and asked for, like, can you explain this to me? Oh, great. Now explain it again. You've done that. So I think we need more, because it's hard, right? We need more of that, but also moving towards, you know, performance measures that the state wants. You know, what do we want to see? And I would encourage us all to be thinking about that as we work through this. As the feds cut the money and we go to our friends in the legislature maybe and ask them for funds to do things, we can't just go say we need, you know, adult ed, just to pick on y'all, since you gave us a number, we lost $6.7 million. So, hey, state, we need you guys to give us that back. It becomes more of a, hey, we lost this money, but here's what we've identified that we need to be able to do these things that, you know, policymakers have said are important. And I think if we can do that, I don't think money is the actual problem. And we can do it without federal intervention, which I'm excited, you know, I think would be a really fun world. But we also have to do really good things at that point. Not that you're not already doing good things, so don't take that way. As we're lumping programs together, you know, if we saw in the federal budget for DOL on the training side, they're lumping programs. They're probably going to do more of that. I don't know. I don't think anybody, if anybody knows, please tell me. We don't know what that's going to shake out like between now and October. So we'll find out. But anyway, as we move towards, move away from high volume and move towards high impact, which has been going on for years now, concentrating the funds on the individual, not just the programs, I think is important. And then really truly looking at, and not from a sense of, and this is something that we have tried to do in the office, and I'm not going to tell you we do it right every time, or most times, but instead of looking at this, oh, that money didn't do what we thought it's going to do, we should take it back. It's more of a, we're just not going to do that anymore. And hopefully you have few of those, but we all know you try something, it doesn't work. It's like, all right, let's just move past that. We're not going to make it a big deal. The legislature's been very helpful with additional funding. We've got some K-12 equipment money. That I think, with training, there's no shortage of dollars that you could spend. So we have to all make sure we're prioritizing those. And looking at the return on investment, we have a legislated mandate to look at return on investment. We're still working on getting that methodology truly right, something that we like. But we've learned a lot over the last few years. And so as we look at this, we now start looking at what is the real ROI to the individual. If we're spending, $6,500 and they're on them and they're only making $15,000 a year, well, let's adjust that. And are they really only making $15,000 a year, or is there a data challenge? Those are kinds of things that we want to look at. I will also say, we've asked for a lot, my office, the legislature, governor, out of the training system the past 3 years. It's been messy, it's been hard, but it's also been rewarding and beneficial. And I think we're all doing that now with this. So I just wanted to say, thank y'all for coming to the table, but also we're going to have to dig in together as we move forward, and really engage with this stuff. We know that this is about changing culture and mindsets really away from compliance and towards accountability for outcomes. But that's also beyond everybody's direct control. So maybe we get there over the next year, with that, and see what the feds change. But that's all I had today, because we don't run the human services programs, obviously. But I did want to say, thank y'all for being at the table with all that stuff. And doing the hard stuff. But I'll also say I think there's a whole lot more hard stuff coming. We all know that. We're all dealing with federal cuts and whatnot. So, Senator, I'll turn that back over to you for your piece.
All right. Thank you, Dr. Taylor. I would suggest probably take about a 10-minute break, and then we can come back and we'll go through questions from task force members. Of course, all our presenters, we'd love to have you back. Don't want to miss the Q&A part, but we'll try to get back maybe 11:20. Thank you.
10 years ago, 15 years ago.
All right, I think everybody has probably returned. We will go ahead and get started on the fun part. I will agree with Director Taylor that it appears when y'all all get together, y'all enjoy one another's company. This is I'll let Chairman Anthony comment on this, but I think I've always heard that, you know, if you see folks at church that talk to one another beforehand and afterwards, you probably got something good. I got an amen for those that didn't hear that. All right. At this point, obviously moving into the question side of things, I'm going to defer to Chairman Bell to start with and let him ask any questions he's got, and then we'll just move around the room to members if they have questions that would be the best way to go, maybe. So Representative Bell?
I don't have any questions.
Representative Bell made it easy. Mr. Chairman?
I have any questions, but I do think we have a lot of notes that need to digest. But I think we're all saying the same thing, and I believe that this is the beginning of how we're going to streamline state services, and we have to do more of this. Because the gentleman from Rehab Services kind of said it. When you all did collaborate, when you got in the same room, saying the same thing, we were able to get these services to the individuals and the persons that's needed. So I think going forward, this is a great start, and I would like to see more of this before we come back. Definitely, maybe in the fall, looking at this again. But thank you so much for that.
Thank you, Mr. Chairman. Rebecca?
Hey, okay. Do you want me to just kind of jump around? I made notes from some of the presenters, so I'll just kind of go through them. I have just a few.
Whatever you would like to do, it's your chance to ask questions.
Okay, for MDES, I just had a question about the Self-Employment Assistance Program, and this may be like a follow-up. But as I was thinking about labor force participation and the idea you've got a program that encourages sort of entrepreneurship, I wonder what how many folks are enrolled, what are their outcomes? Do we have information on like the business duration? So at some point, I'd just love some information on that. Because I thought that was something maybe we could lean into. And then one recommendation I would have, and Dr. Taylor's organization may have this, but Mr. Chairman, for the task force, several presenters talked about sort of the physical locations of their offices. That would be very helpful, I think, in a map if we could show MDES, WIN job centers, DHS resource and referral centers maybe charted out geographically, because I think that was a recommendation from a presenter. So I wanted to offer that. And then I did want to echo what Dr. Taylor said. Claire, I liked the one relationship. And I actually think, was it Daphne who said when folks are coming in the door, they're not necessarily wondering who you work for, but what services they're eligible for. Is that just something anecdotally you get a lot, or could you speak more to that? Yeah, okay. Yeah, that's right. Mhm. Yeah. Mhm. No, I just thought that was very helpful because like the broader context of this task force, sort of the no wrong door or one door approach.
Staples, I'd like to interject.
Oh, sure, yeah.
Miss James and I worked together back in my pre-MDES days, back when I first got to MDA. And I basically stole her out of the northeast corner, and now she has overview over all of the Wind Job Center locations across the state. So we want that local understanding, and then we need to have that for a statewide solution. But again, we don't ever impose from above, and we're working local. That's the key thing too. So everything that relates to getting a job or getting services, it starts with a person that you know. That's so very important.
It seems like that would speak to that trust too. I think someone said they're not going to tell you you need transportation on the first interview, or, you know, that relationship. Yeah. And then I had a question, I think for Shanetta, with Tan. Oh, hey, I see, Tanif. I think I heard you correctly. I don't see where I wrote it in my notes, but on a monthly, about 2,200 TANF cases and 151 are in the work program. Was that
Correct.
okay? Can you help me understand? Because I think you said the comment was the low number, or as a proportion of the 2,200, 151 seems kind of a low number. But you said it's because several of the homes that you're serving are for children.
Several of the cases are
Several of the
considered child only, so there's not an adult in the case receiving benefits.
Okay, so this would be a household or a case in which it is a child only, not in a home with a guardian. Okay, I'm just trying to
Well,
understand.
the child physically would be in a home with a guardian, but a household, at least in terms of a TANF case, is which individuals are receiving benefits. So not every person in the household would necessarily receive a TANF benefit.
I guess my broader question is, and this is probably just ignorance on my part. So temporary assistance for needy families, kind of a welfare to work. But if only a small portion are actually receiving work support, I think maybe I'm just missing the gap here. Maybe I'm misunderstanding. That leads me to believe these are non-work expenditures.
Well, so it's two parts. So the TANF work program specifically is to get individuals into sustainable work situations, right? The temporary assistance for needy families, one of the tenets of TANF is to maintain or keep those children within a household. So having benefits being expended towards a child is still in support of one of the tenets of TANF.
Okay,
Mhm.
that was my confusion.
And I'll share an example of what a child-only TANF case could look like. That could look like a grandmother who is receiving either SSI or Social Security benefits due to age, and that grandmother could not be included in receiving TANF cash assistance, but the grandmother is the guardian for her grandchildren. And so those grandchildren could be eligible to receive those TANF cash assistance benefits.
Thank you. That's
Yeah.
very.
It's a lot of nuances. I'm
No,
sorry.
I'd written down cash assistance and then work program, and I thought I was missing something.
No,
Okay, that's
you're
helpful.
fine.
Thank you. And then I just have one other question, Mr. Chairman. For you, rehab services, do you know, or is this information you can get? Maybe two questions. If you are designated to have a disability that severely impedes your ability to work, like what is the trend line if you receive work support services? Like, do you always maintain that disability status, even if you're back in the workforce, or does that change? I just know sometimes disability can lead to not being in the workforce. So I wondered if that was, you see what I'm saying? Yeah, and then I just didn't know if you could speak to that maybe.
Yeah, the people that.
So for our eligibility for the VR program, if you are getting a disability benefit payment, Social Security, whether you're on SSI, SSDI, you're automatically eligible.
Okay.
Yeah. But if you, those are people that have pretty significant disabilities. I mean, that's a pretty hard hurdle to overcome, getting being put on Social Security disability programs is not, a pretty substantial disability in your life. So while that threshold's pretty high, we serve a lot of people that aren't getting Social Security disability. And those are where our counselors really have to dig in and make that determination whether or not that person at that moment has a substantial impediment to their employment goal. That's where they gather the medical records, they consult with their managers and kind of peer staff the case, make that determination if somebody, in fact, at that moment has a substantial impediment from their disability to reaching that. That could change every time. You may be eligible today. We provide some services. You come back down the road and you receive these services. Let's say hearing aids, probably a good example. You come to us, you're having trouble hearing at work. That's a substantial impediment to doing your job. We get those hearing aids in place. You come back to us 6 months later, the hearing aids are working fine. We would probably deem that you no longer have a substantial impediment to your employment goal, so we're therefore not going to pay for you to go to college or something like that, because that substantial impediment has now been removed by that service being rendered.
Okay, yeah, thank you. That made it clear, that example. Thank you. And then actually I did have one more for the action learning. Yeah, Claire and gentlemen. Y'all talked about the coaches. I think it was maybe Texas or Tennessee. I wondered if you could maybe speak a little bit more to how that operates in the other states, and are these embedded within a single agency? Is this a local state? Can you just give a little more color to that?
Sure, Julio with the Department of Health. So both Texas and Tennessee have built coaching into their workforce strategies, and they use third-party organizations rather than relying on state staff. So Texas and they employ coaches to support the job seekers, and then Tennessee, they've taken it further by using TANF funding to fund community-based organizations who work with families facing deep poverty, housing instability, or reentry challenges. But what makes the third party work is the evaluation infrastructure behind it. So they tie all that funding to measurable outcomes like employment, retention, barriers resolved. And then Tennessee, like I mentioned, even uses third party evaluators to assess the impact and adjust programming year to year. And so at a high level, these coaches, build the trusted relationships. They help the clients set and reach those employment goals, and they work across all the different systems. But they're not serving everyone. They're focusing on very high impact populations like long-term unemployed, young parents, returning citizens, and disconnected youth. So it's a high touch model that is strategic, focused on where this type of coaching intervention can move the needle the most. And then, one big challenge that all the states have faced that Mississippi could possibly face as well is the referral to nowhere problem. And so, again, a coach can identify the right solution, but if the service doesn't exist locally, then it stops right there. And so some of these states responded by giving coaches flexible funds or allowing community partners to create missing services on the ground where there were those deserts. Thanks.
Thank you. That was helpful. I don't think I heard this in the presentation. It was focused on those sort of high impact populations. Thank you.
I'm Robin Parker, and I'm a local workforce. From Nissan. I was working with them to come up with some training programs, and the training manager said, we've got great high school coaches. We need adult career coaches, because what our high school coaches is exactly what should be happening when someone who's unemployed walks into a WIN job center. And so in partnership with Accelerate and ES, in our workforce area, we piloted an adult career coach program. It took us a little while to think through what do they actually do. And then we realized, kind of like the third party, we would serve as, that third party. We wanted to define their outcomes, what their day looks like, the training, and then Reconnect came along. So we actually changed job descriptions July 1 this past fiscal year. And then this fiscal year, we're expanding to ES now that we're going to have 4 career coaches that we work through in WIOA and ES. But once we actually started tying all of this together, and our priority population is long-term unemployed and underemployed, we have served since March. We've served over 150 people, unemployed, long-term unemployed, and we have an 82% completion rate with trained, not just served. Thank you, Courtney. They have actually gone through training. So they come into a Win Job Center. I don't know what I want to be when I grow up. Well, these are your options. And the options we present are priority occupations from the SWIB board. And they literally coach people to that training through completion and then to employment. So it's the high school model modified just a little bit for adults, but it's the same outcomes, the same type of work. And that, y'all have been the favorite thing that I've heard today, because I don't mean to sound negative in any way, but what HS and ES and RS, we've had that for years. We just haven't implemented. It's just been fragmented, and we're all working really hard. We're just all working really hard on our stuff. The beauty of the third party model is if a coach lives at one of the state agencies, they're going to do what that state agency wants, not what the customer needs, because they have performance goals for that state agency. Where if you have a third party system focused on the student, or not the student, focused on the participant, they're going to do what's right for the participant. And it's going to lead to higher outcomes and not just what your funded agency requires.
Super helpful. Sharon. And then just a question, when you say ES, is that funded through Wagner Pizer, or is that part of WIOA? Can you, okay, I was just wondering if you could use some Wagner Pizer here. But anyway, okay, well, that's super helpful. Thank you. Well, that's all, Mr. Chairman. Thanks for allowing me to.
Certainly. Thank you for the questions. Dr. Taylor?
Thank you. Just a couple, Shanetta. And this may not be a fair question to ask, so feel free to say, I don't know that, Courtney. But do you have a feeling for why people decline TANF?
That is an excellent question. It's multi-layered, and some of it is anecdotal, right? So I'll start with what we do have control to change. One of the reasons that's contributing to the high rate of no is how my team members explain TANF. And so we are doing, to someone's point, a massive retraining. And since COVID or the pandemic, the agency lost a lot of seasoned employees. And so we have majority of our counties with employees who do not have the experience or understand the benefits of TANF work program or TANF itself. So that's one cause. Second cause is related to the first one. And a part of what we're finding that our team members lead with are all the risk of being a part of TANF. And those risks are very real, but it's not really balanced in also highlighting what the benefits are. And one of the biggest risks is that Mississippi is a 3 sanctions or 3 strikes and you're out. And in my sharing the income levels, if a household is eligible for TANF, they are eligible for SNAP because our TANF income limits are lower than SNAP. And should they choose to have SNAP and they make a mistake based on the TANF rules 3 times, they could be sanctioned for life for not only TANF, but also SNAP. And that is a huge risk, or scary, depending on how that's explained to count to our applicants.
Is that a function of attempting to decrease the error rate? Do we know if that's why we do it like that?
No, that is just, we are statutorily required to have 3 strikes and you're out.
Federally?
State.
State, okay.
Mhm.
Okay, thank you. One more question there. On the community service, because it's work, community service, school, Who approves the community service? Is that a local, like a case manager, or is there like a list of community service that's appropriate?
I'm actually going to defer to our case management organization. Would you like to take this?
The MDES is a case management association. I'm sorry. The listing, there is a list of folks who are certified, qualified to be work sites.
Okay.
The eligibility piece falls to MDHS, and then the actual putting folks to work and that type thing. And I might need to defer to one of you fellows, but there is a list.
Yeah, so once we receive the referral, then DHS then have an initial assessment, and then we're going to assess the individual case, what barriers they need transportation, work expenses for uniforms or what have you, and we report all that information up to DHS, and DHS is the one that provides the supportive services while we implement the work components and what they need to meet those federal and state requirements in the work sites as well. And you touched on the exemptions. Although we don't handle the exemptions, we still fill out those forms and submit it to DHS. It's up to 24.
Yes.
Thank you. Okay. One final question, and this really is for anybody, but I'm going to start with Billy, because I think you mentioned, I think one of the realities with the, kind of how companies see participants. Oh, this is a SNAP beneficiary. Companies are not alone in this. I see that kind of approach, and frankly, like it's just like, oh, that person can't possibly do this because they're an adult ed student. What do they know? It's like, go take the test and let me know. But is it possible? Realistically, is it possible in your eyes to build a system that companies don't have to know what program they're getting people from, whether it's rehab or employment service? Obviously, if they're, project search or something, maybe there's different, sometimes you're going to know that this person has very special needs, but by and large, is it reasonable at all to have a system where the companies don't have to bother themselves with what program the person is coming from?
We interact with the business community, trying to talk them into hiring our clients. They know where the clients are coming from. Our business development kind of reps out there talking to the business community. But I think if we had more of a joint approach from the core partners to have that outreach to the business community, speak on behalf of all the core partners, then there'd be more kind of anonymity between the programs of what support's been provided to that Mississippian. Business may not necessarily know or care what services, but the way we're doing it now, I think we have a Toyota comes to hire a lot of our clients in that part of the state, but they know when they're working with us that it's a client that has some sort of
Mm-hmm.
But I think it's possible to develop those, deliver those services peaceably. The business community can come to one central point. Not really get into the weeds of what all is up to the person.
Because that seems to be a frustration from the business community. Now, I will say the business community has to step up in every way. And that's the other thing is, as we look at the world today, the world that all of these systems were created in was where we had too many people and not enough jobs. So let's slow them down. Let's put some barriers, on accident, realistically, as a nation. But now it's kind of the other way around. And I'm in the mindset of, one of my frustrations about WIOA is it's kind of all we have as a federal workforce policy. And there are people without any of these barriers who still don't know how to go get these jobs. And so that's kind of how we've tried to approach it with our state funding is if they come to you and they want a job and we say 16 plus, that's what Robin and them operate for us. If they're 16 years and older, let's get them training. But it'd be really interesting to see, what does the system look like when we acknowledge that if the person wants to work and they're currently unable to work, the reason probably doesn't matter as much. The programs may matter, but probably only to the person, probably not to the company. So it's just, I don't know where I'm going with that. It's just a curiosity. So thank you. That's all.
Thank you, Dr. Taylor. General Collins.
Thank you. I don't really have any questions. It's my first meeting. I'm glad to be here, but just a comment. As I was listening to the briefers go around the room here, the thing that kept popping up in the back of my head is, this is a Rubik's Cube. And if y'all are familiar with the Rubik's Cube, of course, it's got, the 6 sides and these 6 different colors. And, the idea is to get all the colors together on one side. And that's right the opposite of what this organization needs to be doing. What we should be doing is trying to get at least one representative color on each side. That way we got the crosstalk, we got the incorporation of each of the agencies working together to benefit the individual out there on the street and gives them the best opportunity to be successful. Now, how you do that, I don't know. We talked about, co-locating. That's a good idea in some cases, but not everybody can have 82 or 84 offices because it's cost ineffective. But how do we do a certain amount of cross training to where when you have that one person, that receptionist at the door, they have enough knowledge, maybe not all the knowledge, but enough knowledge to be able to refer that individual to the right place to where they can get the proper services that's going to help them out. But I don't have any answers to that. But maybe as we meet and we discuss this a little bit more, we'll come up with something that's going to be beneficial to the state, because one of the things that I was thinking about here is we're talking about individuals in many cases who don't have a job. Well, we have a lot of people in this state who are underemployed. And the issue with that is, once you have a job and you're punching that clock 5 days a week, you're not going to stop doing that to go find something else when you clearly have the talent and ability to do something better for yourself. So how do we reach out to those folks to where then they can step up the ladder at least 1 or 2 rungs? So I just ask you to think about that also. Thanks.
Thank you, General Collins. We now have a symbol for the One Door Task Force. It will be a Rubik's Cube, and it will be sitting right here. That is a great analogy. I thought that was really good. Director Ashley?
Thank you, Mr. Chairman. I just want to sum up by saying that the end goal is to get a job. I also want to say the end goal is to get a career pathway from that job as a stepping stone. And then also too, industries and the businesses in those industries matter. When you start looking at our income and our median per capita income as well as our per capita income, I say that, industries matter. So again, we need to play the tune that I guess that everybody wants to hear, not what we want to play. And so I think we owe, again, that's been around for, 10 or so, 12 years. I think every 10 or 12 years, you're going to have some change up at the federal level. I think we're where we are now. I know with the Department of Labor's budget, which has been out for, I guess, a month or so, everybody can look at that. There's some changes that are coming. I don't wish to foretell that, but it's already out there. You can go foretell it yourself. If you can read, you can see, right? At the same time, though, until marching orders come down from DOL, that's basically how we'll start our pivot. But you can ask any of my staff. The only thing I told them after November was the only thing I know we have to do is unemployment insurance and RESEA, which is case management of getting those people that are most likely to exhaust their benefits back on the employment trail. Okay. And then from that, it's all variable. So I think this is very fortuitous that we have this task force, as everything is now variable and can be molded in the way we wish it to be. And so that's my concluding comment for today's meeting.
Thank you, Director. Director Taylor?
Great. I'm really bad at this microphone button pressing. Yeah, that's right. But it's kind of reiterate what I said at the beginning, that I do think there's room for improvement, and we're ready to roll up our sleeves and kind of do the hard work to figure out how to get from where we are to where we need to be. So looking forward to the work.
Bill?
I'm just to echo everybody's comments. It sounds like excited to be a part of the work. I think there is a lot of opportunity here. Any chance that we have to knock down silos or barriers amongst our agencies is a good thing. I share with our staff that if we have somebody call the community college board with an issue that may not be related to community colleges, my expectation is that we connect them to where they need to go, because sometimes that individual may be, our call may be the only call that they can receive, right, that they can make. So we have sometimes a complicated system, and if we can somehow knock down those barriers and increase efficiencies and transparencies, that's a good thing. So looking forward to the work ahead, and thankful to be a part of the group.
Chairman Bell?
I do have a couple of questions and maybe some information that we may need to have for the next meeting. But if an agency is receiving federal funds for workforce training, I would like to know how much money that is and actually how each agency is spending that money, and then what flexibility there is. Like, can DHS do the third party and pay for those coaches, those adult education? And then like in the SNAP and TANF money, what specific skill sets are we teaching, and how are we paying for that student to go to the community college or a night class? I would just like to know where those funds are being spent. And that's all I got.
Thank you, Chairman Anthony.
So I did have some questions. One question, I'm a good Baptist preacher, so I'm gonna close twice. But, and I've heard us talk about the coaching, third-party coaching model several times here. And so if, system-wide, agency-wide, if there were one technical improvement that could be funded tomorrow, what would that improvement look like, and how could we better coordinate case management with that funding? And also, in that same vein, are there any duplicative intake processes agency-wide that we see and that frustrates our clients? And what would a unified intake process look like? And that may be a question that we want to answer the next time, but I would like to see that because what we're hearing oftentimes, we have to submit the same information over and over and over and over again. So if there are some duplicative intake processes, how do we streamline those things? And also, what would that technical improvement, if we could fund it tomorrow, what it would look like for your agency?
Thank you, Mr. Chairman. Couple of things in the question side, and then I think we'll close out. I won't say the number of questions I have because I don't know how many there'll be, but turnover can be government's worst enemy. It's turnover at your agencies. It's turnover in the legislature. It's a change in funding sources, and we're living through that right now. But turnover can also be a good thing, because the way we've always done it's the way we're going to do it is not the answer. And so as we bring new people in, the expectation level should be changed, that there is cross training, that there is an expectation that I work for this agency. And I tell people all the time, I may represent Senate District 5, but I represent the state of Mississippi, and just like these two gentlemen beside me. So I appreciate that everybody is willing to approach it from that standpoint. And from the data collection on the front end, the reason for that, the need for that, is to be efficient in the services we're providing from agency to agency so that we can get the outcome. The days of the outcome being continued funding are over. It's over with the federal government. And I'm going to tell you, when you come to the state and say, supplant, we're not going to be able to do that. First of all, we can't print money. But even if we could, if we're not focused on ROI, and if you're focused on ROI, who's the beneficiary? The first beneficiary is the client. The secondary beneficiary is the state, but the one we forget about is everybody that relies on that beneficiary. So it's families, it's impact across the state of Mississippi. So I know that we want to do that. It's already been touched on, but you need to make a list, not only of what you would change, if you could change something, but the fact that that's a state requirement that deals with the three strikes issue. We need to know that because that's something we can do something about. I can't do a lot about what WIOA is going to look like from the federal government, but we can do what we can do at the state level. There usually are good intentions when rules get passed, but some of the laws we're operating under were passed at a time that's so different than what we live in today that they're antiquated. And we do have to address the SNAP error rate. It's going to cost this state millions and tens and hundreds of millions of dollars. Why are we at 12% when 6% is the threshold? So is it if you want to take a shot at that, I'm glad to hear it. 10.69. All right. You're sort of like me on the labor force participation rate. Ever since I've become chair of this committee, it's gone up 2 or 3 points. I don't know that I've had anything to do with that, but I like to point that data out. And on a side note, I'd like to capture somebody from the Bureau of Labor and Statistics, and Director Ashley, I'll put you up to that, to deliver them at some point and explain how in the world they calculate labor force participation rate, because I've never met anybody that's been surveyed. So
In February, February 2025, they're supposed to meet with us in Washington DC, and Laura, I know Bach, I should say Robert Bach in the corner, they stood us up.
Okay, well, and we get beat up on that a little bit. I know the governor's not a big fan of the number because he's a numbers guy, and if you can't tell me how you got to that number, I don't blame him for not being a big fan of it. He wants to talk about people that are employed, and that's a good thing. The prioritization of services. We have limited resources, unlimited demands. I think that we audit, monitor, whatever term you want to use, for compliance, for fraud. We don't do a lot with efficiency. We have programs out the wazoo that are across your agencies that can be commingled. Some of them can't be commingled. We need to know those things. But there's an apprenticeship program that a lot of people don't talk about, that there's dollars that are available specifically for apprenticeship programs. If we unify that frontline experience, whether it's through coaches, navigators, whatever the terminology may be, that we're going to see people stop pursuing benefits and start pursuing opportunities. And that cuts down on your unnecessary referrals. And I've already expressed this, the 6 questions that were the baseline, in my opinion, are part of what creates unnecessary referrals. Are you employed? Yes. You completely missed the point that General Collins was making, is that if I ask you, are you employed? I also want to know, how long have you been employed? And what is your pay rate? You may be someone who is an excellent employee that is in a lesser than your skill set job. And therefore you need benefits because you qualify for TANF or SNAP, but you're gainfully employed and would desire to move up. We need to be educated on the benefits cliff, because I can tell you some of our quote clients know more about it than they're cross-trained. They know what to say and what not to say. And we need to motivate. And sometimes motivation is not easy and it's not fun. And there's going to be some painful experiences as we move through this, as we lose federal dollars. But I think we can be better at what we do with less money, which is the very definition of efficiency. MDE is not, is MDE on the task force? I apologize. Yeah, we skipped you. I'm sorry. Anything you've got, we didn't even. So, yeah. No worries. I just wanted to make sure you were recognized as a member without putting you on the spot. And one of the reasons I say that is the K-12 system, our community college system, even our universities and community colleges are better now at trying to find a way to give you credit for what you've done. There's been times when it seemed there was a way to find how not to give you credit because then you had to pay for a class. We've moved away from that. But when we talk about the high school equivalency and adult ed, and I've been contacted today from the folks at Northeast, which is in my district, ICC is in my district, and they're very concerned. But once again, by my calculations, we're spending about $6,400 per graduate. If we're spending 13 point something million dollars and churning out 2,065 people, that's about the cost, the base cost of K-12. At some point, we've got to draw together why we're remediating or why we're educating folks that came out of the high schools in our state that we're funding. And whatever the issue is, the head in the sand approach is the money's not there to continue to do that. We're pumping more money into K-12. Our graduation rates are as high as they've ever been, correct? So we're not producing as many new high school equivalency deficiencies. We're producing people that are actually graduates. I looked at Tishomingo County and it was 20-something hundred people. But if you back it out to 25 and up and the 64, by my calculations, it appears a third of that are greater than 64. Once again, where are we targeting? We shouldn't have as many young people based on that data. And I don't know if it's data or data, but either way, it's numbers. And I do want to make sure that at some point there's an accountability level at the K-12 system that goes back to say, why are we continuing to see this deficiency, particularly that category of people that have a high school equivalency, but are not reading on a grade level that they can go get employed. So I want us to be able to do that. And a lot of this is the same things that would be in closing, I guess. And I'm like y'all, I'm not going to ask a lot of drill down questions, but there'll be a lot of follow-up questions. But I guess from the standpoint of action items, the working group idea, you don't need legislative approval to do that. It would be well appreciated and well understood to do that. Whatever barriers that we have to communication or barriers that we have to people utilizing services, I go back to the waiver. If there's something that is impeding you at the state level, tell the legislators. If there's something impeding you at the federal level, ask for a waiver. You know what the worst they can say is no. But at least we're going down that road. And then the use of technology. I would be very interested in how we are utilizing or approaching, and I'm not as tech savvy as I would like to be, but there's so much out there that can be done that people are used to getting. I call it the red triangle. Y'all ever tried to fill out something online, getting some tickets to a concert or buying something online? The red triangle means you cannot proceed until you fill that out. Our clients understand the red triangle. We need to make sure we're getting the information that we need to serve them best. So let's use that technology. Uniqueness across this state. Northeast Mississippi, where Representative Bell and I are from, is very different than Indianola. It's very different from the coast. We know there are employers because we have had some of the largest economic development announcements in this state that we have ever seen. Some of it capital investment, but a lot of it jobs that are not online yet. From Steel Dynamics to what they're doing in Grenada to what they're doing in Marshall County and many other places across this state. So the upskill opportunities are there, while we also don't want to cannibalize our labor force. But the opportunities are there for us if we can do that. But we need to be nimble. We're going to be accountable, and we're going to be efficient, because if not, we are not going to be able to serve the populations that we're supposed to serve. One of the negative naysayers before this committee ever met wrote a lovely op-ed that talked about how we're just opening the door to benefits and the state of Mississippi is not going to be able to afford it. You have that working against you. We have that working against us as policymakers. There are people out there that have worked since they were 18 years of age until they're in their 60s, and they don't have a great appreciation of why people aren't working. Now, they had a different background, maybe. They had a different foundation, but there's also people that have overcome no telling what to be successful. But today, we have, and one of the things I will say for Director Taylor and Rehab Services, and it goes back to your question, there are a lot of people employed today that would be unemployed or on disability, but for the services that Rehab Services is giving on a regular basis that keeps them employed. And I don't think people realize that. When I sit down with you and your team, that was one of the things I was always thinking in a different manner, but we're keeping people employed, which has a great ROI, because if not, they're in something else. But we have a dramatic rise in autism in this state and in this country. Part of it's because we do a better job early on identifying, but we have people who, what we really want, what everybody wants, is somebody reaches the highest level they can attain. If it's a disability that holds them back, it only holds them back as far as the level of their highest attainment. And that should be, I think, our goal for our constituents and for everyone else. So, Representative Bell, I'll be glad to let you make closing remarks if you have any, or did you? Hey,
Y'all tell the difference between the House and the Senate?
I only went over my target by 8 minutes, and in my world, that's pretty good. Thank you all. Yes, and I will, what's it called? Those fancy a doodle poll will probably go out. I've, again, not knowing much about technology, I filled one of those out recently, and, yes, no, maybe on about 8 different dates. We will establish additional dates. We want to give you enough time to kind of generate some of the information that's been requested. Of course, this is streamed and archived. You can certainly go back and listen to the long-winded explanation again if you'd like. But thank you all for serving, those that are task force members, for agency folks that are out there doing the hard work every day. I don't want you to ever feel like this is a criticism. It is an opportunity to do more with less, because that's the circumstances that we're in. And that's a challenge. It's a challenge to the state of Mississippi. It's a challenge to every agency. It's a challenge to the governor's office. Most everybody in here is an executive agency. So we want to work hand in hand with the governor's office as the legislature to make policy that allows you to be effective and efficient and accountable. And thank you again for your service. And with that, Dr. Taylor.
If you have any data, additional items, if you presented today or if you didn't present today and you have some data that you want the whole committee to have, will you please shoot that to me in the next 24 hours, and I'll send that out as kind of a follow-up to all of this. With those questions, we're going to get those questions nailed down, just so, hey, these are general questions that the chairs wanted answered to. And we'll get that out to you guys. I say 24 hours. That probably means 48, maybe even 72, but the intention is 24. So.
All right. Well, thank you, and we will stand adjourned.